Rasausadas are having high potency and they are having very good immediate action or rapid action within small dosage. Because nowadays everybody is asking for a medicament which is acting in lesser dose. The people are not having the patience or acceptance for larger dose. How the classical Ayurvedic literatures have emphasized to administer 2 pala, approximately about 96 or 100 ml of kashaya, or churnas are referred as 1 karsha, 12 grams, or vatis of 3 to 4 grams at least. Nobody is ready to consume the medicament in that level. Even on one of the journal by name Current Science has published one article that Ayurvedic medicines are fed like cattle feed. Probably it is in between 2002 or 4. So they have teased us and criticized us correctly, because that was in practice in 1400 or 1500, etc. Everybody was practicing. Whereas nowadays, if I ask a patient to consume 3 to 4 grams of churna also, nobody will be ready. Or tablet 2 to 3 grams, nobody is ready to take, because our mindset is just like allopathic medicines. They are giving 1 or 2 tablets or 125 to 250 milligram. Likewise, our drugs also should work. In that respect, Ayurvedic medicine, that too, Rasashastric medicines are considered to be good. The Rasashastra has become the integral part of classical Ayurvedic practice, that too, classical general Ayurvedic practice nowadays. Why the Rasashastra practice or concentrated over Rasashastra become the mandate nowadays? The reason is the rising chronic diseases. Nowadays, people approach Ayurveda only for chronic diseases, whereas 200 years ago or even 50 to 60 years ago, people used to approach Ayurvedic physicians for every kind of illness. Some exceptions may be there, some parts of the country like Kerala, etc. there, even for the conditions like infective fevers, infective arthritis also, they approach Ayurveda. Otherwise, people rarely approach towards Ayurveda and they think that only for the minor illness or for the chronic diseases, Ayurveda is best suitable. Whereas, even though some of the acute conditions can also be treated effectively, people's choice will be the secondary towards Ayurveda. However, as we are getting more of the chronic diseases, even in my personal experience also, I am getting more of the chronic diseases. Rasashastra medicines are looked into in an effective way. Also, we need the medicaments which are acting in a fast manner. Immediate results are expected, because most of the people who are of working class, if they can't attend the duty for one day, they are losing minimum 500 to 1000 rupees minimum. So if they are not ready to quit the job and they have to take the medicine, they should get the relief. And those who are preferring Ayurveda, they want to have their cure by lesser medicaments and immediately, or reliable research we should show. That is why Rasashastra becomes mandate. Also, another important point is, earlier people used to take the kashaya or kashaya churna, take home, and thereafter they used to prepare the kashayas or lepas, etc. Nowadays, nobody is ready to prepare the medicines by themselves. That is why they need instant medicines, that too cost-effective medicines. If we are taking the kashayas or kashaya drugs, it will be costlier. Then the question comes, there is a blame that Rasashastric medicines are very costly. It is not like that. And many medicaments are of 50 rupees or 1 rupee also. So many medicaments are cost-effective too. That is the point what we are going to discuss in the last slides. So everybody is asking, doctor, within how many days or within how many hours I can relieve from my complaint? Whereas when we consume Rasashastric medicines, we can assure some of the effect of the medicaments in the best way. That is the advantage. Moreover, the last fourth point is very important. Rasaushadhis bridge traditional wisdom and modern challenges. Because every time, everywhere, people are asking how a drug is acting and what is the working principle. In case of herbal medicaments, even a single herb is having multiple chemical constituents, or a formulation is having 10 to 15 or more than 15 ingredients, and ultimate effect of those combinations is very difficult to predict. Whereas Rasashastric medicines, usually they are administered as a single medicament, maybe Abrakabhasma, Lohabhasma, Shankabhasma, etc. Or minimum combinations are included in the majority of the preparations. That is why giving rational is also very easier. With all these perspectives, Rasashastric medicinal practice considered to be more convenient, feasible, and possible nowadays. Let us review some of the aspects as I have mentioned in the beginning. First aspect, whenever Rasashastra is discussed, rapid action and high potency. The Rasi Bhavanti Lohani Mrutani Surabandite, that is a famous quotation. Whenever we consume any of the Rasaushadhas, starting from Maharasa, Uparasa, Sadhan Rasa, Dhatu, Upadhatu, Varga Dravyas, they are converted into, these drugs are converted into medicines, and by the time they will be attaining the minimum particle size. Whenever any substance is brought into a minimum particle size, it is getting more ability to penetrate, or the kind of dispersion will be easier, more penetration will be there, more bioavailability will be there, quicker action is possible. Nowadays, they give the title of nanoparticle. Our medicaments, even though thought as nanoparticles, more aspects will be there beyond nanoparticles, because the kind of structural arrangements, the nature of the medicament, the way how it penetrates are having much more to discuss. Whenever time comes, let us discuss. However, as a part of high potency, we are now in the time period where we are confident to treat even some of the conditions where public seek or come with us. For example, fever. Even though in the states like Kerala, people prefer to have Ayurvedic kashayas, asavas, arishtas, etc. They need immediate medicine, immediate result, effect, lesser dosage. By the time the Rasashastras are coming to help. Nowadays, nobody is ready to take kashayas, asava, arishtas, or churnas, lehyas, etc. to the workplace. Whereas Rasashastric medicines can be taken very easily, or then can be carried very easily. That is why people expect it to act immediately. And in that respect, the diseases like fever, dyspnea, varieties of gastrointestinal disorders, respiratory illness, some kind of pain and inflammatory diseases of the joints, muscles, etc. can be treated effectively by our medicaments or formulations. And importantly, it is Rasashastric medicines are very important or apt to treat in OPD level, because general practice is referring to OPD practice only. So even though not all emergency conditions where we see that or we think that that is an emergency condition which can be treated through Ayurveda, surely Rasashastric medicines will be upper hand, or they will be coming as priority. So those who want to treat the emergency conditions or critical illness conditions more than herbal medicaments, Rasashastric medicaments can be taken. And when we discuss or when we take this topic, first we are thinking, as we have discussed in the beginning, this smaller dose or minimum bulk. Nobody is ready to take a large amount of medicine. Otherwise, the medicine becomes the food. So, smaller medicaments are also having bigger or greater impact, just like alpahi matro vipula gunascha sadyo isaddipana pachanamcha. So, even with the lesser medicament, it is having more penetrating ability, more bioavailability. That is why maximum effect is possible within short duration. As we know, some of the medicaments which are having parada, or which are having arsenic, etc., we are administering as minimum as 30 to 40 milligram also, or sometimes till the extent of 125 or even as 500 milligram we are giving in case of the Shankabhasma, etc., we can give. And moreover, these Rasashastric medicaments are easier for administration or feasible. Feasibility will be more with respect to kids, women, or to whom we consider Komala Prakriti people, even in elderly patients, for patients who are debilitated, etc. And another advantage is patients who are well educated regarding Rasashastric medicines. They will be happy to receive the medicaments because it will be in smaller dose, and majority of the medicaments are not having any particular taste, or they will be acceptable by all because the amount is very small, and that too they are administered along with water or with the honey, ghee, etc., which are accepted by all. Whereas in case of kashayas, asava, even churnas, etc., if we recommend them to take part with particular anupanas like kashayas, etc., they are not, sometimes they are not readily available or difficult to carry, and that is why people hesitate. It is once again a repetition. In a nutshell, it is having a long shelf life as well as stability also. Majority of the Ayurvedic preparations are having on an average shelf life of 6 months to 1 year. Classical literatures, they have mentioned, probably second year juniors or seniors may be knowing, the churnas, etc., are having a shelf life of only 2 months as per classical literatures. But today, the kind of churna available, or how it is packed, how it is sealed, how it is transported or made availability, based upon that, it is having a longer shelf life compared to earlier days. That 2 months time period can be extended till 8 months or 1 year also. Whereas Rasashastric medicines are having longer shelf life. Many a time here I want to emphasize one thing. With respect to Rasashastric medicines as well as Asava Arishtas, one wrong interpretation is given, like Puranasyu Gunair-yukta Asava Dhatavu Rasaha. Wherever I go, I want to emphasize it. Puranasyu Gunair-yukta Asava Dhatavu Rasaha. By this word, many teachers as well as clinicians are giving the translation as Rasashastric medicines or the mineral medicines, herbo-mineral preparations, or Asava Arishtas are found with increased potency. Shastra never told it. Puranasyuhu Gunai Yukta. Gunavardhana is not told. Even they are becoming older, they will be retaining their medicament potency. However, it is a matter of pleasure that Rasashastric medicines as well as Asava Arishtas are having longer shelf life. That is why they will be stable for longer period. That is the advantage. Even if we bring any of the Rasaushadhas to home, or a clinician is keeping the Rasaushadhas in his shelf, no need to worry for few years. Whereas in case of churnas, etc., very often we are tensed when it will be expired, whether it is losing its potency, whether it is infected, etc. That kind of difficulty will not be there with respect to Rasaushadhas. And another advantage is clinical storage is very easier, because nowadays it may be in a rural part or in metropolitan cities, the clinics will be restricted for about 140 square feet or maximum 150 or 200 square feet. Within that, arrangement of all the medicaments, Asava, Arishta, Taila, Kashaya, Leha, everything is very difficult. Whereas Rasashastra medicaments are occupying lesser space. That is the advantage. And even transportation is also very easy. That is why, if at all customized medicaments are made, or like travel kits, or the healthcare kits for adults, healthcare kits for women, etc., by using Ayurvedic medicines, Rasashastric medicines, it will be easier. And moreover, earlier people used to talk that Rasashastric medicines or medicinal practice is suitable only to the cities, not to the rural area. Whereas today, if we educate the people of rural area with the Rasashastric medicines, a good achievement can be carried, because I am also practicing in a very rural area, and in these 23 years, I practice only through Ayurvedic medicines. However, today's topic is Rasashastric practice. I am not restricted only for Rasashastra medicines. I am practicing herbal medicaments also. The medicinal practice includes 60 to 70% herbal medicines and only 30 to 40% Rasashastric medicines. But in many area, the Rasashastric medicines in combination with the herbal medicines, good result we can get in rural area if we educate them appropriately. And another more very important point is, no need to prepare fresh preparations in case of Rasashastra, because majority of the Rasadravyas which are readily available, or they are already in finished product stage. Whereas in the case of Kashaya, etc., Kashaya powders are given, or churnas are mixed with some adjuvants, and then they have to consume. They have to be consumed. Whereas Rasashastric medicines are not like that. They can be taken directly. That is an advantage. Further, these Rasashastric medicines are having wider therapeutic utility, because even though swasthasya swasthya rakshanam aturasya vikara prashamana is the intention, apart from that, all these rasaushadhas are rasayana dravyas also. That is the advantage. And a person who is coming as a patient is always debilitated, maybe bodily as well as mentally. That is why rasayanas are having unique position in therapeutics. And majority of the rasaushadhas are having good immunomodulatory action. And moreover, every kind of disease is having some kind of the inflammatory changes. That is why the medicament, Rasashastric medicines, have proven efficacy as anti-inflammatory. That is the advantage. Moreover, another point, that is a sixth point, organ-specific support. This is the new point what we should educate to the public. Whenever people utter Rasashastra means always they'll be scary. They are fearsome that these medicaments are harming heart, kidney, lungs, brain, pancreas, etc. Whereas if we educate them, or if doctor himself is well aware where it is acting, where it is, which is the target cell, surely its best effect can be found. And all these rasaushadhas are having, because rasas as rasayanas, they are having very good srotoshodhana property, and by nature itself, they are having Deepana Pachana effect also, because majority of the Rasadravyas are Laghu, Ruksha, Ushna Tikshna Guna, or Laghu, Ruksha, Shita, and Deepana Pachana actions are there. Next, benefits of Rasaushadhas with respect to medicines, not Rasa Aushadas, Rasa Dravyas as such, because all these Rasadravyas are processed appropriately. That is how its toxicity is removed and made suitable into medicine by various processes like Marana, etc. Though that is why ultimately these Rasaushadhas remain as biocompatible. And nowadays, many a time people ask how to rely or how to believe the Rasaushadhas. If necessary, we can read the literatures regarding each product. If the products are from the reputed companies, they usually made available of all their products as well as their standards. That is the advantage. That is why with respect to Rasaushadhas, if the physician himself prepares and sells, that is the advantage, or else he should depend upon the companies which are of higher standard. That is the advantage, because most of these preparations are now standardized, and batch to batch record, batch maintenance record are kept, and that is the advantage where we can feel some kind of security while prescribing, or while dispensing, or as while taking the medicine by a client. And already I have discussed, nowadays people are approaching towards Ayurveda for some of the unique diseases, diabetes, maybe some kind of liver diseases, some kind of skin diseases, arthritis conditions, autoimmune disorders, chronic and sometimes acute respiratory diseases, neurological disorders, what we call the Vatic disorders, infertility issues, etc. In all these conditions, Rasaushadhas are giving best result. That is why we need to follow Rasaushadhas in selective conditions, not in all conditions. Further, these Rasaushadhas can be practiced alone with the Anupana of Madhu, Gruta, or respective Anupanas which are specified. Whereas the physicians like me, when I practice more of the herbal medicines and less of the Rasaushadhas, synergetic effect also I can get by administering the Rasaushadhas with the adjuvant or with the Anupana of herbal medicines. And the advantage is Rasaushadhas are having, majority of the Rasaushadhas are having Ushnatikshna property, or else they are having Yogavahi effect. That is why the penetration to the target cells where it must hit, it will be achieved at the earliest, because Rasaushadhas are acting because of Prabhava also. That is why there is no necessity to give the medicaments in higher dose, and it is supporting in multi-level healing. Means already how I have explained, they are having good action as a broad spectrum. The multiple diseases can be tackled at a time. That is the advantage. And once again, by changing the Anupana Dravyas, or by changing the Sahapanas, or by prescribing specific wholesome diet, we can change the action of the drug also. That is the advantage. Lastly, the medicaments, Rasasastric medicaments, are comparatively cost-effective and practical. However, this question is a kind of debate, because they will ask, Rasaushadhas are always said as the very costlier medicines. Rasaushadhas, if we are prescribed usually in the dose of 1 to 2 tablets, or 250 to 500 milligram tablets, when compared to Kashayas, Asavas, Arishtas, etc., which are prescribed in the dose of 50 ml, 60 ml, etc. So if we compare them, surely Rasaushadhas are not so costly. Only those medicaments which are derived from Swarna, Rajata, etc., especially Chintamanis, Brihadvata Chintamani, Shwasakasa Chintamani, Makaradhwaja, all these medicaments are costly. Otherwise, commonly used Arogyavardhini, Chandra Prabhavati, Shirastoda Gulika, or the medicaments like Tribhona Kirtirasa, Ananda Bhairavarasa. These medicaments are not so costly. They are quite economic. Compared to that, even Ghritas, Lehas are costlier. And already it is discussed, these Rasaushadhas are easy to stock or store. So, as we are giving more hope with the more of the rational medicament, patients will feel satisfaction out of these kind of medicaments. That is the advantage. And lastly, if at all the physician is busy in seeing multiple patients, means in an hour he has to take 10 to 12 patients. Truly, as per classical Ayurvedic way, if we are following as per Desha, Dosha, Bala, Kala, Adala, Prakriti, Sattva, Satmya, Hara Shakti, Vyayam Shakti, etc., or Dashavida Parikshas, etc., it is very difficult. Whereas Rasasastric medicaments can be practiced like modern medicines. I am not equating like modern medicines, because in rural areas, if they are coming for symptomatic relief, also Rasasastric medicines are considered to be best choices. But here are some points. While practicing Rasasastric medicines, we need to think of some of the things, because our practice must be ethical and judicious. In a sense, in a irrational manner, we should not practice, because sometimes a patient who is having renal impairment or is already having liver disorder, etc., we should not emphasize, or we should not have a first choice as Rasaushadhas. We should think of other medicaments, herbal preparations, if in those respects. And because safety is the first priority. And while selecting the formulations also, we must opt the reputed pharmaceutical companies, or else we have to prepare ourselves. Substandard products or the pharmaceutical companies which are producing or which are making available with the very lesser cost. Because if at all, for example, if Arogyavardhi is made available for the cost of 8 to 10 paisa, it is surely we can't believe on that. So better to skip those kind of preparations or pharmaceutical companies. And very importantly, we need to follow classical guidelines. Means we should be thorough regarding the formulations of their adhikara and their ingredients, as well as classical mentioning or references, as well as actions. And irrational combinations are to be avoided. That is very important point, because nowadays the prescription of a physician or an Ayurvedic physician also goes to the extent of his prescription pad. If the prescription pad is of about 30 centimeter, 10 to 15 prescriptions can also be found. So always Rasashastra medicaments should be restricted for only, if possible, only one medicine or two, maximum 3 medicines. There should not be more than 2 or 3 medicaments, because irrational combinations may always go wrong. And once after prescribing a Rasaushadha to a suitable patient or a client, we should monitor them. Sometimes in urgency or as per the patient's demand, if we prescribe the medicine or dispense the medicament for 1 month, 2 months, 3 months time period, we may go wrong. The medicine may do harm, and ultimately you may be blamed from the society. Also, we need to educate the patients appropriately while taking or while prescribing Rasashastric medicines. Proper Vatyapatyas, etc. are to be prescribed. Ultimately, Rasashastric medicines are giving fast relief, high potency, long shelf life. They are having broad therapeutic utility, and if they are prepared appropriately, they are safer, and they are cost effective, patient friendly, and economic. It will be easier for a physician also to prescribe. I believe the Ayurvedic general practice will be complete only if Rasaushadhis are practiced appropriately. And if you are having any query in your mind, please make note of it. In the right side lower corner, my slide number is there. Based upon the slide number also, you can raise your question, or in general also you can ask your queries. And for the beginners or those who want to go for pure Ayurvedic practice, in fact, I don't have the confidence or courage to say that the bookish knowledge of Ayurveda Rasashastra is not sufficient for a general Ayurvedic clinical practice. If at all you want to concentrate more on the Rasashastra preparations to prepare yourself or to dispense in your clinical practice, better to opt to 2 or 3 best books out of this list, especially Ayurveda Sara Sangraha. I will show the picture of that. See, Ayurveda Sara Sangraha of Baidyanath company, or I can tell. 1 minute, I will see the time. Okay. Ayurveda Sara Sangraha is a book which is published by Baidyanath Ayurveda Bhavan. It is covering more than 380 best sold or best prescribed Ayurvedic Rasashastric preparations, and especially the pharmaceutical, the products of Baidyanath are highlighted. I am not recommending the products of that company, but book is best to practice as well as to prescribe. And another one is Rasatantra Sara Va or Rasatantra Sara Evam Siddha Prayoga Sangraha. Once again, it is there in Hindi, and recently I have seen its English translation also. It is another best book to practice. And third important thing among the Rasashastra PGs, we never look into the Uttarardha of Rasaratta Samuchaya. Actually, we need to concentrate on the Uttarardha of Rasaratta Samuchaya. And if at all we are preparing some medicaments ourselves for our clinical practice, we need to look into it. Very effective, simple preparations are there in Rasaratta Samuchaya, Uttarardha. And in Rasatarangini also, Prayoga Vijnana means a therapeutic utility, how a formulation must be practiced appropriately, that is discussed. If we are thorough regarding the formulations, their unique applicability with respect to various contexts in a doshic level, dhatu level, disease level, the stage of the illness is also found with suitable anupana, suitable aushadha pramana, as well as pathyapatyas. That is why especially Rasashastra PG people should look into it, look towards this. And anybody is knowing regarding Kannada, in Kannada, Pandit Taranath, in his name, Taranatha Ayurveda Medical College is there in Bellary, and he is the founder, and in his name that institution is there. In Kannada, he has published a very good book, best book, Prasiddha Rasaushadigalu, the best Rasaushadas that can be bought. And another Hindi book is Vaidya Chintamani. Recently in English version also it is available, published by Chaukamba, Vallabhacharya Krita Vaidya Chintamani. Few selective formulations are excellent. And in Gujarat, pharmacopoeia, Ayurvedic pharmacopoeia, Bhaishajya Sangraha can be practiced. And lastly, one Chikitsa Pradeepa book is there, written by Dr. B.V. Gokhale. Best book to understand the way how the medicaments must be prescribed. Surely, no, the person who reads this for the first time will not understand anything. Whereas if the clinician or a student reads the book repeatedly 2, 3 or 4 times, surely he will get the glimpses to practice. Here are the images. Ayurveda Sara Sangraha, Chikitsa Pradeepa, Vaidya Chintamani, Prasiddha Rasaushadigalu, and Rasatantra Sara Va Siddha Prayoga Sangraha. Most of these are available in online. Now I will go to another topic or the slide. Few unanswered queries of the beginners, because my concentration in this slide is only the UG students. What is our beliefs, or when being a student, what we think? Rasasastric medicinal practices can be made only by the Rasashastra postgraduates. No. Many Rasashastra, the non-postgraduates can also practice Rasashastras, but only they should be thorough regarding Rasadravyas as well as their qualities and the apt way of preparations and proper pharmaceutical companies which are manufacturing. Then they can also practice. MD is not a must to practice Rasasaushadas. And not only PG Rasashastra, no MD is also required. If you are confident, if you are thorough, mere BAMS practitioner can also practice Ayurveda, Ayurvedic Rasashastra. Then Rasasastric medicines available in the market are substandard or not reliable. Not all firms. Today, more than 20-25 pharmaceutical firms are there which are preparing quality Ayurvedic medicines. Better to depend upon those pharmaceutical companies instead of believing or depending upon the medicaments which are of poor nature or which are considered to be cheaper. Rasashastra medicines are not suitable to all. No. Rasashastra medicaments can be made suitable if you are thorough. The minor illness like ulcers and major illness like cerebrovascular accidents, heart diseases can also be equally managed through Rasaushadas. Only thing is we should be thorough. We should find out whether the people are suitable, because of desha, dosha, bala, kala, etc. And if any allergic factors are there, by assessing all those, we can prescribe all kind of medicaments. I prescribe Rasaushadhas even for a infant of 15 days, 20 days also. Rasashastra medicines should not be practiced in organ damage. No. There are so many medicaments which can be practiced in the liver diseases, heart diseases, kidney diseases, etc. But the only thing is we need to look into the patyapatyas, anupanas and proper dosage. Rasashastra practice does not need doshik knowledge. That is once again the wrong belief. Because of the shloka, na dosham, na dusham, na vivechanam, because of that shloka which came after 19th century, people started uttering this, and it is not appropriate. If doshik knowledge is there, Rasashastra medicaments can be practiced in a best way. So that is why the precision in doshik knowledge, if we have, good, there will be every chance to get success in lesser duration. Then most of the classical Rasashastra medicaments are not available. That is what every clinician is telling initially. No, majority of the Rasaushadhas are available from various pharmaceutical companies. Only thing is we should look into the therapeutic guidelines, or we need to go to the website of the respective pharmaceutical companies, and from there we can select the best one. We need to be cautious regarding Rasashastric medicinal prescriptions. Yes, undoubtedly, it's a big yes. Whenever we are prescribing Rasashastra medicines, we should see all the aspects of the individual. And surely in herbal medicines also that is mandatory, but whereas it is more so with respect to Rasashastric medicines. Anupana, Sahapana, Patya are crucial in Rasashastra medicinal practices. Yes, we can manipulate the drug action easily by suitable Anupanas, Patyas, etc. Otherwise, medicine may become wrong. Rasashastra medicines are always costlier. No. Many medicaments are there, like Tankana Basma. Once again, I have kept a separate slide for that. Godanti Basma is there. Swarnamakshika Basma is there. They are very economic. Costly Rasashastric medicines are usually effective. May not be, because to highlight their brand value, etc., they may give higher price. It is not so. Economic or cheaper Rasashastric medicines are always quality compromised or substandard. May not be. Some quite economic medicines may also work in an excellent way, like Lagasuta Shekhara Rasa, Gairika, Shuddha Gairika, Shuddha Tankana, etc. Rasashastra medicines are like modern medicines. No. In some respect, as a supplement, if it is administered, it is okay. Otherwise, it is not like modern medicines. Rasashastra medicaments are working entirely different way from herbal medicines or Kashta Aushadas. It is not true always. If the time permits, I will discuss. Rasashastra practices can be carried by mere textual reading or therapeutic books or guidance. Though we need to look into each and every aspect of the drug, and then only we can arrive at. Best Rasashastra practices need proper guidance by the experts. Surely, the best practice can be carried not mere by reading or not mere hearing. We need to do ourselves, then only we can achieve. Next, guidance for general practices. I have taken some of the examples to narrate it from my practice. For example, fever. In general, I am not consider infective fevers and fevers of chronic origin, etc. See, whichever may be the kind of fever, in general, if Arogyavardhini is given in the dose of 500 milligram or 1 gram with Sudarshana Kashaya, majority of the disease conditions can be treated effectively. But it is not like, I am not equating to paracetamol or any other antipyretic, but best results can be obtained. Few more formulations can also be added for this, and in 60 to 70% of occasions, mere Arogyavardhini, or in Kerala, I think they are giving even an Abhivati also, that is also having good result, or The formations which are having Vatsanabha, they can be practiced. They are also giving good result. And in case of Vata predominant conditions, once again, Lakshmi Narayana Rasa can be practiced. In Pitta predominant Jwara conditions, Ananda Bhairava Rasa or Kamaduga can be practiced. Kapha predominant conditions, Tribhuvana Kirti Rasa can be practiced. Likewise, based upon the Doshik predominance, we can opt some of the preparations. Here I have prescribed only one medicines. In my practice, I am giving only one medicines and maximum 2 medicines. Or else, a single medicine can be prescribed in the best dosage. It means, example, in Vata predominant fever, Lakshmi Narayana Rasa, 2 or 3 tablets means 250 to 500 milligram tablets can also be prescribed if we are prescribing that medicine alone. Whereas 2 or 3 combinations are preferred at a time, then that is not the best way. We have to reduce the dosage. Another example is Amla Pitta. In general, if Sutta Shekhar Rasa is given, majority of the Amla Pitta conditions, acid peptic disorders can be controlled. Whereas in Vata predominant conditions, Dhanvantara Gutika with warm water, or Pitta predominant conditions, Kamaduga with Mauktika can be practiced. Or in Kapha predominant conditions, Laghu Sutta Shekhar Rasa or Kalamega Kashaya, along with the Kalamega Kashaya or water can be practiced. In case of Shita Pitta, which is a common complaint, often it is correlated to, depending upon the features, articular rashes or tropical eosinophilia conditions, Nagaguti or in from Ibis company, isonofol tablet is coming. Rarely I use the patent proprietary products, but this preparation I am practicing, which is having Nagaguti, it is having very good effect. It is having Navagrahi. And Vata predominant conditions, Abrakabasma with the Rasasindura or Rasasindura with sugar candy is good, giving good result. In Pitta predominant conditions, Godanti Mishrana or Kasisa Basma with water or Paripatadi Khada or Saptamrataloha with Shirisha Kashaya are giving best results. Whereas in Kapha predominant conditions, Arogyavardhini or Shilajitu containing formulations are considered to be good. As an adjuvant, Kalamega Kashaya, Shirisha Arishta can also be practiced. In case of Shirashula, once again, because we come across these kind of patients in rural area, Shirashula in general, instead of Sarida and all this one, that one modern preparations, if we give Shirashula Vajrarasa, it is giving good result. 1 to 2 tablets twice or thrice in a day, we can prescribe if necessary. And or else Palsinuran capsule is there available from Phytopharma. It is having Ekanga Virarasa, and that can also be practiced. It is also giving good result. In Vata predominant conditions, once again, Vata Vidvamsa Rasa can be prescribed, or Vata Gajankusha Rasa is effective. In Pitta predominant conditions, once again, Kamaduga with Bhauktika or Laghu Sutta Shekhar Rasa can be prescribed. Here, see, in the earlier case, I have mentioned the Laghu Sutta Shekhar Rasa in the context of Kapha predominant in Amla Pitta conditions. You can see 21 slide. Whereas here, I have prescribed it in the conditions of Pitta, because Laghu Sutta Shekhar Rasa is having good action in the Kapha Pitta predominant conditions. That is why, depending upon the context, we need to prescribe the medicament. In case of diabetes, once again, it is not the Samula Chikitsa or Adya Chikitsa. For symptomatic relief, if at all we are thinking, mere Chandraprabhavati alone can be prescribed along with the Asanadigana Kashaya or Mamajjava Ganagati, Nicostemna literally, it's a botanical name. Its Kashaya can be used, it is giving good result. But if at all we have to think of the Samula Chikitsa, Shodhana, the procedures are to be adopted undoubtedly. Whereas if it is moderate conditions, I will not go into the values of HbA1c or for ppbs, etc. In general, I have kept here. Each one needs elaborate description. Whereas moderate conditions can be treated by Chandraprabhavati along with the Shilajituvati or without or without Nishamalaki Kashaya, Nisha Kathakadi Kashaya, etc. In case of severe conditions, once again, Chandraprabhavati or Mamajja Ganavati can be prescribed along with Nisha Kathakadi Kashaya, Kataka Kadiradi Kashaya, etc. Once again, time is running. Once again, in case of facial paralysis, in the initial condition, the Rasaraja Rasa or Brihadvata Chintamani Rasa can be prescribed. Or else Vata Gajankusha Rasa can be prescribed. It is giving good result. Whereas that is why, see, if at all a person is not affordable, we can't prescribe Rasaraja Rasa or Brihadvata Chintamani Rasa. In that case, mere Vata Gajankusha Rasa or Vata Vidvamsa Rasa is prescribed, it will serve the purpose. That is the advantage. If we know the condition of the patient and the status of the patient, socio-economic status of the patient, we can opt the best suitable to the individual. Or we can prescribe Abrakabasma. Once again, in affordable patients, we can opt Sahasraputi Abrakabasma, or else Shataputi Abrakabasma can be prescribed. If they are not affordable even for Shataputi, then 20 to 30 Putta Abrakabasmas are also available. They will also give the result. But for the best result, Shataputi Abrakabasma is, Sahasraputi Abrakabasma is best. Or else, we can go for the higher medicaments like Chintamani Rasas, various kinds of Chintamani Rasas. They are giving good results. Here I have given one medicament, that is Tankana Basma. Rasashastric medicines are not only for internal usage. Even by taking a single medicament, Tankana Basma, we can achieve good practice in several conditions. See, I have given 7 to 8 examples by taking simple medicaments. All these are practiced by me. Example, in wounds and ulcers, especially if pus discharge is there, watery serious discharge is there, then dusting of Tankana Basma, Tankana, Na2B4O7, 7H2, sodium borate. It is a very simple preparation. And 100 gram costs only 7 to 8 rupees. This medicament is very effective in case of wounds and ulcers. Whereas in itching of the skin lesions, for some of the fungal infections also, the Tankana Basma is mixed with the turmeric powder and can be applied. Even tinea versicolor, where white patches are found around the chest or neck, face, etc. In these conditions, mere Tankana Basma is mixed with the lemon juice, fine paste is made and it is applied all over the body or over the lesions. Within 10 to 12 days, best result can be obtained. During the medication, once again, Raktashodaka Aushadas like Arogyavardhini, etc. can be prescribed. Parpatakarishta, Shirisharishta, Paripatadikada, Kalamega Navayasa, etc. can also be prescribed for best result as well as to prevent the recurrence. In case of dandruff or head lice, once again, dusting or application of Tankana Basma or mixing the fine paste prepared of Tankana Basma and curd, this is also working good. And in itching in the anal region or personal parts, often this kind of complaint, the patients are approaching because they will be fed up by taking more, many kind of local applications or the tablets, effervescence tablets, etc. In that case, mere this kind of medicaments are giving best result. Wash with the Katakarohini Kashaya or Fanta, which is added with Tankana Basma. For about 1 mug or a tumbler full of Katakarohini Kashaya is taken, to that Tankana Basma is added, mixed thoroughly, and that area, it may be anal region or personal parts, must be washed thoroughly. In case of ear discharge, once again, Tankana Basma with the Samudra Fena Churna, they can be put. Within 2 or 3 days, best results can be observed. Likewise, in wounds, ulcers or gangrene conditions, turmeric extract in the market, Haridra Rasa is available. It is dissolved in lime water. Here, not lemon water, lime water. Churnodaka, as well as Tankana Basma. They are mixed together and washed. And once again, in mouth ulcers, Tankana Basma is mixed with the honey and it is applied over the mouth ulcers, stomatitis conditions, etc. Even in skin tag conditions, this Tankana Basma alone is helpful if it is of minor kind or only 1 or 2 body parts it is found. Tankana Basma is mixed with the Yavakshara, then fine paste is made little water can be added, then it is tied or applied. Good result can be found. This is a very economic medicaments. Likewise, we have studied Bahukalpam, Bahugunam, Sampannam, Yogyam Aushadam. Single medicaments are capable to manage different kind of illness. Here are some examples. By a mere Arogyavardhini or Chandraprabhavati, by taking the help of Godanti Basma or Bolabadharasa, Shvetaparpati, Sanjeevani Vati, Gandhaka Rasayana, or formulations like Tankana Basma, etc., we can treat 70 to 8 types of diseases or disease conditions. Only we have to alter the dose, alter the anupana, alter the applicability, means time of administration of medicine, etc. By that, good results can be found. In detail, for its detailed knowledge, better to refer classical literatures like Rasa Tarangini, or compendium texts like Ayurveda Sara Sangraha or Rasatantra Sara va Siddha Prayoga Sangraha. Let us discuss regarding one such example, Arogyavardhini, for example. It is effective as Amapachaka, Vidagdha or Samapitta associated conditions very effective, and it is Tvakdosha Nashaka, it is acting as Rakta Shodaka and as Roto Shodaka, Medohara. That is why wherever these kind of actions are required, there we can prescribe Arogyavardhini. See, Arogyavardhini can be used in Kamala. Usually I prescribe Arogyavardhini along with Patola Katrohinyadi Kashaya or Patya Katfaladi Kashaya. Occasionally, the Chandraprabhavati can be added along with that. Even Staulia cases or even Prameha in general, not diabetes, urinary disorders can be, or initial diabetes conditions can be treated. Once again, Arogyavardhini followed by Asanadikana Kashaya, Manjishtadi Kashaya, Kathakadiradi Kashayas, Anupanas. In varieties of Medo Vikaras or Vidradi conditions, see, you can see the variation in the dosage. In Kamala, I prescribed Arogyavardhini in the dose of 1 to 2 grams. Staulia, Medo Vikara, 500 milligram to 1 gram. In Vichachika, Sidma, Granthi conditions, 250 milligram to 1 gram. The medicament is prescribed. Now, let us take the example of Chandraprabhavati. Once again, Chandraprabhavati is Kafapitta Prashamana, Vata Udasina. This is very important aspect. Anybody is interested to look into this Udasina Varga, there is a book by name Keshava Krita Siddha Mantra text. In that, varieties of drugs, how they are acting in different doshic levels are explained. For example, a medicament which is Vatavardhaka, Pittavardhaka, Kafahara. Vata Hara, Pittahara, Kafavardhaka. Vatavardhaka, Pittahara, Kapha Udasina, means it will not act on the Kapha, or it is not having significant or direct action over Kapha. That is Udasina, Vata Udasina, Valya, Vrishya, Rasayana, Srotoshodana, Medohara, Rakta Prasadaka, Garbhashaya Balakara, all these actions are there. Accordingly, they are finding their application in Staulia, menstrual irregularities, pospituria conditions, spermaturia conditions, etc. And another important point I will touch in this slide. There is a book by name Sanjeevani Samrajya. It is a compendium of about 230 to 240 pages. That book is of 200 to 240 pages approximately. And single book is concentrated only regarding Sanjeevani Vati. More than 1,000, because Sanjeevani Samrajya means more than 1,000 prescriptions are there related to Sanjeevani Vati. How Sanjeevani Vati can be prescribed in Jwara, Raktapitta, Unmada, Apasmara, Udara, Gulma. In this way, they have given explanation with Anupanas, Sahapanas, dose, etc. It is a best kind of book. I have given the link. See, this is the information related to Sanjeevani Samrajya, and in few Gujarat libraries it is available because this was published initially in Gujarat. Yes, it is having 236 pages. Very interesting book, and good clinicians can adopt it for their practice. And there are some physicians by name Trifala Vaidyas, Haritaki Vaidyas, etc. Likewise, they are the Sanjeevani Vaidyas. They treat every kind of disease by taking only one formulation. And dhatu level applicability can also be witnessed through Rasaushadhas. Like, for example, Shodhana, Prasadhana, Dhatu Pushti. All the three can be achieved only by Rasaushadhas too. Only thing is, we need to peep into the depth of the classical literatures. For example, Rasadhatu Shodhana is possible by considering Kasisa Basma or Loha Basma with Trifala Churna. Or else, Rasa Prasadhana is possible by Saptamrita Loha or Sukshma Trifala. Please go through the Sukshma Trifala in the internet. Articles are available, which are practiced more by the North Indian physician, that too Maharashtra people. Sukshma Kalpanas. Rasadhatu Poshaka, Dhatri Loha, Mukta Pishti, etc. can help in that regard. Likewise, I have given the example of Rakta Dushti also. Rakta Dhatu Shodhana, Rakta Dhatu Prasadhana, Rakta Dhatu Poshaka, etc. But ultimately, we are coming to that. Before regarding the exact, whether some internet issue is there, whether video is coming. Okay. Before regarding the exact, before prescribing any of the Rasaushadhas, we need to know regarding the ingredients, Bhavana Dravyas, exact dosage, proper Anupana, specific Pathyapatyas. Always better to adopt the pharmaceutical companies which you know or which supports and which are preparing the quality products, and also select the best products which are available from the market. In the sense, all products of a single company may not be right, or the medicaments of only few companies may be also not right. We need to select the best medicaments of few of the companies. It will be more apt and quite economic also. And the adoption or selecting proper adjuvants or supporting herbal medicaments, or what we consider as Kashtaushadhi, is also important. And whenever possible, dilute the medicaments or increase the bulk with the herbal ingredients. For example, when we are prescribing the Loha Basma, always better to mix with the either Ashwagandha Churna, or it may be Trifala Churna, or likewise. I usually prescribe Swarnamakshika Basma in skin diseases by mixing with the Bunimbadi Churna. Then know the Prakriti of the individual. That is very important with respect to Ayurvedic practice. That to Rasashastra practice. Even though Ayurveda in general emphasizes Rasashastra, it's more so. And understand the reason or Udbhava Karana of the disease properly. That is very, very mandate with respect to Rasashastric medicaments. And in general, Samprapti, Vighatana, if we are very thorough, then it will be easier to approach. And Rasashastric medicines, after proper Shodhana, if they are prescribed, best results can be obtained. And importantly, better to prepare ourselves at least 5 best sold medicaments by ourselves, which are quite easier, quite effective, and quite economic preparations, like Laghusuta Shekhar Rasa tablet, or one preparation I am preparing by name Navajivana Rasa, or some such preparations. If we are preparing ourselves, it will be easier, and it will be a trump card for our practice also. Once again, there may be some curiosity. What are the medicaments this person has kept in his shelf? Even though long list is given, because occasionally I use some of these medicaments, but my clinic is having not more than 30 medicines in my shelf. However, I prescribe these medicaments in various occasions, like Chandraprabhavati, Kamaduga with Mauktika, Pravala Pishti, Abraka Basma, Loha Basma, Swarnamakshika Basma. Most of the Basmas I I opt from Dudh Papeshwar company. Kankana Basma, I prepare myself. Arogyavardhini, Shilajituvati, Arkashala company, Shilajituvati I am using. And Gandhaka Rasa, I am preparing Dudh Papeshwar company. Then Shuddha Gairika, myself, Shuddha Gandhaka, Shirashuradri Vajrasa, Pravada Panchamrata, Shweta Parpati, Saptamrataluha, Malabar Ayurveda Ashrama. From that company I am prescribing. It is providing best variety of Saptamrataluha. Lakshmi Narad Rasa, Lakshmi Vilas Rasa, Sutta Shekhar Rasa. Rarely, today also we have prepared a Swarna Raja Vangeshwar Rasa. It is having best result in Presidentia conditions and some kind of the prolapse conditions. It is having good result. If patients are ready to accept our medicaments or they are not ready to adopt or accept modern medicines, for them, by informing or giving all the details, we can prescribe such medicines. And Swarnavacha or Swarnaprashana Grita, I prepare myself. I am preparing Swarnavacha myself. I think this is a strong area where if we are preparing Swarnavacha, best results can be achieved, because those who approach me for the issues like autism and Alzheimer's disease, etc., this Swarnaprashana Grita and Swarnavacha both are having good result. Kasi Sadhi Taila for application, Pranabhairava Taila, once again, best medicament to treat varieties of ulcers. Then Vishagarbha Taila, Tankana Basma, Godanti Basma, Samudra Fena Churna, Shanka Basma, Shankhavati, for various kinds of abdominal pain, including severe kind of menstrual pains. Shankhavati along with Dhanvantari Vati is having good result. Vataka Jankusharasa, Rasamanikya, Chandrakala Rasa. Once again, it is another best preparation. Chandrakala Rasa, varieties of bleeding disorders can be managed appropriately by Bolabhadra Rasa and Chandrakala Rasa. And many patients who are fed up with the modern medicaments for their problem of DUB, etc., can be treated effectively by Chandrakala Rasa along with Bolabhadra Rasa. Agni Tundivati, Ichabedi Rasa, Vata Vidvamsa Rasa, Kasisa Basma or Annabhedi Sindura. These are having good result. Ultimately, we are coming to the end. Rasaushadha is, or Shastra is not optional. Instead, it is essential for modern Ayurvedic clinical excellence. That is my belief. With this, I conclude. If you are having any queries or doubt or difficulties while understanding my lessons, you can approach. If I know, I can tell. Otherwise, I can refer and surely let you know. Thanks for the opportunity once again. Sorry for the disturbance which caused in between. I have taken enough time of 1 hour. Thank you.
Thank you, sir.
If anyone have doubts or questions, you can ask directly to sir.
Yes, surely. If you are having any question, surely. Welcome.
Sir, you explained about many Rasaushadis for different diseases. So can you explain some of the Rasaushadis for adenoid problem for children?
Yes. Usually, I am getting sufficient cases. Especially, see, this is the advantage what I believe. On online platform, this kind of patients are more than my regular clients. Because they fed up. Usually, they ask to go for operation, etc. They usually parents are not ready to accept it and go for that. So in the market, one preparation is available which is derived from Nagaguti, from IMIS company. IMIS company is preparing Isonofol tablet, EOSINOPHAL, Isonofol tablet. I am prescribing this in Kapha Pitta predominant conditions, Rakta Pradoshaja Vikaras, or the cases which they name it as allergic disorders or tropical eosinophilia conditions, even including adenoids, even tonsillitis also I am prescribing. This one medicament is sufficient. Other than that, you can prescribe Pipalyasava or some Kafahara Ushadas, which are effective in Shasana Samsthana, respiratory diseases. It is given, but we have to do it for prolonged period, minimum 30 to 40 days we have to give, and we should avoid all these patyas. Once again, the oily food or butter added items, cheese, all these things must be avoided. We should educate them. That is important. 30 to 40% occasions we need some kind of education, or else we can ask them to have gargle. If the kids are above 6 or 7 years, we can ask them to gargle with Haridra and Daru Haridra Kashaya. Haridra and Daru Haridra equal quantity is taken, Kashaya is made and it can be used for gargling. In a 70 to 80% of occasions, Prayatnasya Prabhu Vaidyaha Na Vaidyaha Prabhu Aishaha. So 70 to 80% of occasions, without operation, we can manage.
Sir, thank you, sir.
Okay, welcome. Anything? Any more questions?
Sir, any medicines in COPD conditions?
Hello?
Hello. Am I audible, sir?
Whether my video is, yeah, you are audible. Whether my video is coming appropriately or not?
Video is not coming, sir. It's okay, sir. Okay.
No problem, no problem. Okay. What is the condition you told? COPD condition.
Yes, yes.
Chronic obstructive pulmonary disease. You
Yes.
mean, right?
Yes, sir.
Okay. See, I am from the Jamnagar tradition. If the patients are affordable, any kafahara aushadas like kafaketu rasa, from Rasashastra perspective, if you need, or Makaradwaja containing formulations can be used. For example, how I am nowadays, I am not using Makaradwaja frequently. Earlier, I used to do that. And Karnataka Shringi, because Karnataka Shringi Churna is not available, or Karnataka Shringi Basma is not available nowadays. It is not available in my part. Otherwise, Karnataka Shringi Basma is mixed with the Makaradwaja, Siddha Makaradwaja, or Swarna Ghatita Makaradwaja is available from Dutpapeshwar company. It is powdered, mixed thoroughly, and that is given for licking. Another preparation I am using in the ratio of 10:1. Oh, it means 1:10. Sorry, 1:10. Rasasindura is mixed with sugar powder. Mere Khanda Sharkara is taken. I am taking that red lal khandi, means red colored Khanda Sharkara. Its fine powder is made and it is mixed in the ratio of 1:10. And that is given for licking, followed by Shirisha Arishta according to the condition. But if this is practiced for prolonged period, surely the recurrence chances will be reduced. Even those who are suffering from pneumonia, etc., after their antibiotic course, etc., if they reach us, surely I am prescribing the same medicaments. But in a majority of the cases, I am adding pippali as an ingredient. Pippali, either see Sukshma Pippali, I have kept in my clinic. Sukshma Pippali, probably you may be knowing. The Pippali fine powder is made and it is added with the 64 parts of the Kajali. It is mixed thoroughly and then weight-wise, right? Okay. Then it's the fine pudikas, means sachets are made, it is given in the dose of approximately 125 milligram. It is giving good result. Pippali, Sukshma Pippali, like Sukshma Trifala, Sukshma Pippali. It is giving good result.
Thank you, sir.
Once again, see this Nagagati containing formulations, I appreciate. And it is having very good result. Nagaguti containing formulations in upper respiratory tract and lower respiratory tract disorders, even allergic diseases. But Shwasakasa, Chintamani, etc., I usually never prescribe. I never prescribed Shwasakasa, Chintamani, etc. in my clinical practice. It doesn't mean that it should not be prescribed. I don't know much regarding, because I prescribe the medicaments regarding which I am thorough. Yes, please.
Okay, sir. Thank you, sir.
If no more questions, sir, we can fold it.
Sir. Good evening, sir.
Good evening.
Sir, I have a query. That you have told about usage of Rasashadris in autoimmune conditions. So whether we can use various medications.
Pardon me. Usage of Rasashadris in
autoimmune conditions like thyroid, we can use such medications.
One minute. Why I got. Yes. Please continue. Please continue.
Sir, is it possible to use these Rasashadris in autoimmune conditions like thyroiditis and all?
See, autoimmune disorder is a broad term. It is just like a thief in a marketplace. Thief in a marketplace. We have to. We don't know how that person is harming us, or which thing he will taking away from us. If we know exact mechanism, what is happening, for example, autoimmune diseases of the joints, autoimmune diseases of the respiratory system, autoimmune diseases of the hormonal system, that can be managed by the symptom complex followed by the Udbhava Karanas. See, even though autoimmune disease, see, some of the triggering factors will be there. For example, some kind of autoimmune disease, see, example, SLEs. See, we need to understand what is the triggering factor. If we are not knowing the triggering factor, blindly giving the medicaments may not give the longer result. It may give momentary result because I am treating some of the SLE cases because of their compulsion, because that is not my choice. Because of the compulsion by the patients I treat. What happens? The moment or the duration when they are taking my prescription, they will be all right. After a period of 1 month or 2 months, it is happening even with the psoriasis cases also. So during the kind of time of treatment, they are giving good result. They are getting good result. After 2 to 3 months, they will be indulging in fish, milk, curd. Immediately the conditions will flare up. That is why, if we know, this is not autoimmune disorder is a broad term. If you specify the condition, in those cases, we can help them. I am not telling about cure of the disease. We can give the console, means pacification of the illness.